Okay, so firstly, I'll start off by saying it's great to be taking part in this conference again. It's always an insightful one to be part of. Today, I'm going to be talking about how we can take lessons from human behavior during the pandemic and apply that to the environmental crisis that we all face. So I think to do so is quite fair. If I were to describe to you a threat that is not immediately visible, affects some groups worse than others, and requires everyone to make sacrifices for the good of the collective, I could be talking about our behavior during the pandemic, or I could be talking about climate change and how we're going to address it. So my aims today are firstly to identify the most consistent psychological predictors of compliance during the pandemic, and then also to discuss how these might relate to climate mitigation. So to achieve that first aim of identifying the most consistent psychological predictors of behavior, I'm going to be relying on the ESRI's social activity measure. So this is a study that we've been running since January in collaboration with the Department of the Taoiseach. The results are posted regularly on gov.ie. And essentially what SAM is an anonymous interactive online survey. It uses methods from behavioral science to help people recall their recent activity. So it's a prompted recall study where we ask people neutral, fact-based questions about their recent behavior. So things like the locations they visited and any mitigation behaviors that they might have engaged in. Now, some of you might be concerned about the level of accuracy or honesty that we're going to get in these kinds of measures. So this is something that we have looked at ourselves. So we have a publication in the Journal of Epidemiology and Community Health that tries to estimate those sorts of biases in population estimates of compliance. But for SAM, what we're really interested in is how our measures change over time. So we're not particularly interested in a specific time point or the percentage of people who say that they're doing one thing, but we're interested in how that changes over time. So the trajectory of it, are more people saying that they're wearing a mask now than wore one last month? And also the magnitude of those changes. So is that increasing enough? The study runs every 2 weeks and collects responses from a nationally representative sample of 1,000 adults. We have publications detailing our sampling methodology. And at the moment, we're up to 22,000 responses. So we've had 22 waves of SAM, and we're forecasting that to continue on. So it's quite a rich data set that we can pull on to try to predict and see what matters for people's behavior. So now I'm going to walk you through a kind of shortened version of what our respondents do when they're taking part in SAM before I get on to some of the results. So at the outset, people are just told that we're interested in the kinds of day-to-day activities that people are doing in Ireland at the moment. You'll note that we don't specifically mention anything related to the pandemic or to COVID. We reassure people that all responses will be completely anonymous, and we ask people to try to answer as honestly as they can. But the more accurate answers they give, the more helpful they'll be. The next stage then is our prompted recall stage. So this draws on what's called the day reconstruction method in psychology, where we split people's days up into different episodes. So we have the morning, we have the afternoon, and we have the evening. And people complete this for the last 2 days. So if I take part on Monday, I could be asked to think about what I did on Sunday morning from when I woke up until lunchtime, and just to make note of the kinds of things I did outside of my home, or did anyone call to my home. Now, these responses are not ones that we particularly analyze. These ones are to prompt people's memory that we can then use in questions later on. So following on from this, we have a checklist here of different places and locations that people might have gone to on Sunday, and they'll also complete this then for the day before. So if I'm taking part on Monday, I'll be asked this for Saturday and Sunday. So you can see here, for example, that I can say I went to another person's home or garden, I might have gone to work, might have gone to a cafe, pub or restaurant, to a gym, and so on. I can also say that I didn't leave home for any reason, and we ask people also if they had any visitors to their home. For any of the activities then that I did yesterday, we have follow-up questions. So for example, if I say I went to a cafe, pub or restaurant yesterday, and say I went to a cafe, I'm asked then if I sat in or if I took away, and then if I decided to sit in, did I dine indoors or outdoors? You can see here that if I say I dined indoors, I'm asked if someone checked if I had a cert proving that I've been vaccinated or that I recovered from COVID in the past 6 months. And then there are further follow-up questions. So questions about, for example, how many people outside of my household I might have met there, how long did I stay there, were the staff wearing masks, were they wearing masks correctly, how busy was the location, was the location well ventilated, and so on. So what we're getting here is a really rich data set, not only of people's behavior, but of the kinds of locations that they were in and how risky those locations were. So what this allows is for us to look at, for example, how many people are going to different locations and how this is changing over time. So this is just an example chart here where you can see, for example, that the proportion of people who are visiting outdoor locations in this brown line, that has been decreasing as restrictions have eased. So it even started to decrease during the summer despite the good weather. And you can see also, for example, that in the maroon, the dark line here down along the bottom, that as restrictions eased around hospitality venues, more and more people were visiting them. It also allows us to calculate, for example, how many close contacts people are having. So if we take the HSE definition of a close contact, so within a 2 meter distance of someone for longer than 15 minutes, and then sometimes if you're in a poorly ventilated indoor location for longer than 2 hours, we can count those as close contacts and see how many people are having close contacts and how many close contacts they're having. So you can see here, for example, that the average number of close contacts people have has been increasing since the summer. What it also allows then is more global estimates of how much social activity people are engaging in. So here we have our index of overall activity, which takes into account the different locations that people have gone to, how many people they met, and so on. You can see a step jump here once restrictions started to lift around April, and it has been steadily increasing since, and a dip during the summer. And then we can also classify people by how much risk mitigation activities they engage in. So when people leave their home, do they very often or always engage in risk mitigation behaviors, such as wearing a mask, trying to keep distance from other people, maybe choosing only to venture into well-ventilated locations or to dine outdoors, or do they rarely or never engage in those? So you can see again here that the proportion of the population in this top green line, they do, who are very often or always taking precautions, tend to be the largest group, but the share of the population that make up this group has been falling since late January, February. So these are the kinds of details that we can get from SAM, but where SAM goes beyond a standard survey is with questions that we ask at the end. So we ask a host of psychological variables that we can then relate back to behavior. So for example, here we have questions about people's perceptions of the restrictions. So how confusing or straightforward do you find it to understand what is and what is not allowed under the current restrictions? Down the bottom here, we ask people to take the current restrictions together, and we ask them how contradictory or coherent do they think they are. And you can see here in the middle, we have one of our attention check questions. So to make sure that people aren't just trying to click through the experiment or the study as quickly as possible, we ask people here to just click 1 on this scale. So again, what this allows us to do then is relate those responses on the psychological variables to people's behavior. So I'm going to show you here quite a complicated graph, but essentially we're going to take a host of the psychological variables that we have and see how they relate to behavior over different periods of the last year. So down along the bottom, we have how worried people are about the pandemic, how they trade off the burden of restrictions against preventing the spread of the virus, how coherent they judge the restrictions to be, how easy they are to understand, how much they're paying attention to news coverage, how tired they are following restrictions, how confident they are in the government, and how much they think other people are complying with public health guidelines. So what we can see here is essentially the further away any of these dots are from 0, the stronger the relationship is between that psychological variable and people's behavior. So you can see, for example, here that worry is quite strongly related to behavior during the initial lockdown in January, March of this year. As restrictions began to ease, we still see worry is important, but the burden of restriction is no longer important. When restrictions were further relaxed during the summer, we see further changes to the psychological variables, and again, further changes in September, October. So During the last period of September, October, we can see that worry is important, but also fatigue, which the effect of it is becoming stronger over time. Okay, and we can summarize this chart now in the following table, where we can see that worry and coherence have been the main drivers of behavior throughout 2021. Other variables are sometimes predictive, sometimes not predictive. One other thing to flag here is that fatigue with restrictions was assumed to affect compliance with behavior as early as March, April 2020, but we didn't see any evidence of that until summer 2021. So I think this just highlights how important it is to measure behavior. Okay, so if we take our lessons from COVID-19 then, so the pandemic is a useful starting point for understanding psychological drivers of behavior during a crisis. What this suggests is that worry is important during a crisis, and that when it comes to climate mitigation, that we should be focusing on overcoming the psychological distance of climate risks. We also need to make sure that we're coherent when communicating what's expected of people. And in order to be coherent, it's going to be important to identify potential misconceptions. But, and this is where I want to get into a bit of a discussion about where the limitations of lessons from COVID-19 come in. Recent polls by Eurobarometer back in March and April showed that the vast majority of the public think that climate change is a serious problem, a very serious problem. So you have 81% of people say that it's a very serious problem, whereas recent polls by the Irish Times show that a vast majority tend to oppose a lot of the economic measures that are proposed to tackle climate change. So here we have at least some of the people who say that that climate change is a serious problem, but yet they oppose taxes on things like fuel and petrol, oppose taxes on air travel, oppose making petrol and diesel cars more expensive. So what does this mean for applying lessons from COVID-19 to the climate crisis? Firstly, it suggests that maybe there is a majority already convinced that the climate crisis is something to worry about. But instead, I think we need to just take lessons from COVID-19 as a starting point for understanding how we're going to mitigate climate change. One of the key differences here is that solutions to the COVID-19 pandemic, or the ways that I can mitigate my risk against COVID-19, are fairly uncontroversial. I can wear a mask, I can limit my interactions with people, I can only interact in well-ventilated spaces. People's perceptions of solutions to climate change, however, these are things that we don't know very much about. That there is a gap there in the literature and in our understanding of how different psychological variables affect support for the predominant economic climate policies like carbon taxation and so on, that tend to be quite controversial. So I'm going to leave it here, leaving it with an outstanding question, but I'd love to hear people's feedback on this and what they think might be useful steps forward for understanding these. Thanks.